we are aware, the tuberculosis, or what usually we call it TBC, is still a major health problem in Indonesia. If we're referring to the WHO Global TB Report in 2020, currently in Indonesia, all over the world, globally there is still like 10 million people who have with the TB problem, and it causes like 1.2 million people die from TB, the disease. And Indonesia is among of 8 countries that account for 23rd of the TB cases worldwide. And we are the second rank after India with like 845,000 cases per year, which means like our incidence is 312 per 100,000, and for the mortality is like 98,000 deaths per year, or it's equivalent with 11 deaths per hour. So our mortality rate for tuberculosis is 34 per 100,000 people.
The Philippines is the 4th globally in terms of TB cases. Of course, number 1 India, and then we actually contribute to 7% globally in terms of the gap of underreporting and underdiagnosis for TB. 17% India, 11% Nigeria, Indonesia is 10%, Pakistan is 8%, and of course the Philippines at 7%. And based on the National Prevalence Survey done 2016, about 1 million Filipinos, that's equivalent to 1% of the population, to have active TB. And when the current population of the Philippines is 108 million Filipinos. We also note for a fact that if you talk about deaths or mortality rate of TB, TB is still the highest infectious disease killer in the Philippines, killing 3 Filipinos per hour, if you translate that to the 29,000 deaths per year. In terms of catastrophic cost, you defined catastrophic cost as a household spending more than 20% of their income spent for TB diagnosis and treatment. So in the Philippines, about 35% of Filipino households encounter catastrophic costs. In terms of health-seeking behavior, there are about 1 out of 3 who would prefer to consult the private sector. So the private sector has a huge role too in terms of seeing the TB patients. However, quality of treatment in the private sector may be unknown, and in terms of not all private providers do notify their cases, so they actually contribute to the missing cases, what we call missing cases, in the national TB program.
India has one of the highest burdens of tuberculosis in the world. The World Health Organization estimated an incidence of nearly 27 lakh cases in 2019, an increase of 25% compared to 2018. Nearly half of these cases come from 5 Indian states: Uttar Pradesh, Maharashtra, Madhya Pradesh, Rajasthan and Bihar.
We know during COVID-19 pandemic, it's almost all the routine program hampers of on that condition, yeah. And since we are affected by the COVID-19, the number case finding and case notification for tuberculosis keep decreasing. The facts that show that were infected with COVID-19 continues to be increased. And of course, this situation also has an impact on the efforts to control TB disease. During the pandemic in 2020, it was reported the TB treatment coverage rate dropped quite drastically from 60% in 2019, become almost half in 2020. It was like 32.2%.
Impact of COVID in TB elimination efforts in the Philippines is really very huge, especially when the ECQ, Enhanced Community Quarantine, was imposed last April. So that was almost a month or so, 2 to 3 months of ECQ, or the Enhanced Community Quarantine, which restricted travel for people to actually seek care and receive treatment. And because of these general restrictions imposed, there was a dramatic decline of TB notifications as well, to as high as 29%. So they did a prediction. Study in collaboration with the UCSF, University of California, San Francisco, when they were in the Philippines providing this technical assistance. And they did this prediction using this 29% decline in notification. They actually predicted that if TB services will not resume in 2 months, there will be additional 81 cases that, 20,500 cases that will be added to the incidents, and sadly additional 12,600 deaths. But if we are able to prolong the resumption of TB services to as long as 10 months, then additional 95,000 cases will be added, and additional 28,300 deaths due to TB. So it's very urgent that we resume TB services, even and despite the COVID pandemic. But I would like also to share that because of the COVID pandemic, there were also lessons learned, and it kind of facilitated some treatment gaps or behavior in terms of the health seeking of the general population. So the awareness about wearing masks actually contributed also to the decline of the transmission. We are now more aware of infection and prevention control measures because even during before the COVID pandemic, even TB patients did not want to wear masks when they are initially diagnosed to have TB, and are actually required to wear masks during the infectious stage. But because of the COVID pandemic, I think the realization that it has become a general norm to wear masks everywhere, regardless whether you have TB or not, as a part of the general health standards. Also, in terms of contact tracing, we are now more aware of the beauty or the science behind contact tracing. During the COVID pandemic, if you have an index case of COVID, then you really have to do contact tracing among all the family members and all those who were exposed to the index case. Likewise for TB, it should be done. So the realization that contact tracing even among TB patients were also more realized during the pandemic.
The diagnosis of new TB cases saw a dramatic drop during the lockdown period, according to the Central TB Nikshay portal of the Government of India. According to a study published in the Indian Journal of Tuberculosis, there was nearly 60% underdetection of new cases during the 8-week lockdown period between March and May 2020 compared to an 8-week period pre-lockdown. There was also considerable disruption of TB services both in primary care as well as hospital setting.
As we are know, when we are going to revitalize the TB this during the pandemic COVID-19, we need to implement the health protocol within the TB activities. And what we are try to ensure these TB activities can conduct normally, we have like adjusting some activities. The first one is we need to ensure all the logistic for the drugs and the diagnostic facilities are in place. And we know that due to the social restriction, it might affect on delaying the distribution of the drugs and other laboratory logistics. So with that, we need to really calculate the number that the logistic and the drugs that we going to distribute. So it should receive timely in the health facility. And we try to modify the socialization or TB campaign, that we are usually implement face-to-face with the community. Now we try to change it to the digital communication channels, or we can use like radio or social media, and it might be like flyers, banners, or might be billboards, and of course through the digital media we need to put some message on the TB case finding, like in the Twitter, Facebook, or in the Instagram. And of course, the ensure the case notification and the treatment success, we try to monitor. The first one for the treatment success is monitoring of the patient itself should be changed to the online system. So we need to ensure all the TB patients have give their contact number, either their self or their families, that the health staff or the cadre can give support and can ensure they're taking the drugs routinely, and especially when they have facing a problem, for example, like a transportation or anything, the cadre or the health staff can contact them and ask this patient to get their drugs, or ask the family to get the drugs that might be already passed by the patient.
During the height of the pandemic, there were a lot of consultations done, to address the challenge of restricted travel, etc. And we know for a fact that when you talk about TB, you have supervised treatment where patients go to the clinic, receive their treatment, etc. But under the pandemic, you cannot do all those things. So during the pandemic, the National TB Program under the Department of Health issued what we call the NTP, or the National TB Program Adaptive Plan. So this is where changes or revisions in the usual policies and how things should be during the pandemic were actually encouraged. So example were to integrate TB screening during the COVID screening opportunities. Also in terms of testing, they actually promoted that even if, for example, you need to do testing for COVID, and the patient is actually you ruled out COVID, you still have to offer the possibility of TB testing, especially for patients who have high risk to develop TB, and also vice versa. In terms of treatment, we used to offer patients going to the health clinic every week or so. But under the pandemic, they relaxed this a bit to make it more patient-centered. So patients are allowed to bring home 1 month supply of their TB drugs to avoid the frequent trips to the clinic. Also, we allowed telecontact supervision of treatment. So patients were allowed to call the health center or the TB nurse. Also, TB nurses were allowed to contact patients more frequently. So we also shifted to what we call digital platform. So aside from telephone, we use telemedicine to reach out to patients so that for patients who are afraid to physically go to health facilities, they are allowed to still consult or seek care using the telemedicine platform. We also saw the increase in the use of digital adherence tools. We now have what we call the video digital observed treatment, where patients are actually monitored on their treatment intake, not physically, but using these gadgets to confirm whether they actually took the medications or not. And this is very useful, especially for the drug-resistant TB patients, where the regimen were longer compared to the drug-susceptible TB patients, where treatment was actually shorter. Also, during the pandemic, the National TB Program was actually creative enough. They utilized social media as a platform to reach out to the patient. So there were TB projects working in the Philippines, funded by USAID and Global Fund. So we have the TB Innovations and Health System Strengthening Project. We also have the TB platforms working with the communities. So they created a social media platform where this is based on the Facebook, where patients actually discuss about their treatment across the continuum of care. Also, I would like to add to the what the government did during the COVID pandemic. During that time, the manual of procedures of the Department of Health. So this is like the guidebook for how treatment should be, how TB management should be. It was released last year, and when it was released, it was during the lockdown when the lockdown was announced. So the government actually shifted to digital platform for training healthcare workers. So instead of conducting face-to-face training, capacity building activities, they shifted to the virtual platform using Zoom or any other digital platforms to reach out to the healthcare workers for training purposes.
In order to address the dual morbidity from COVID-19 and tuberculosis, and to address the missing TB cases, a number of strategies were adopted. This included bidirectional COVID-19 TB screening, screening for tuberculosis in influenza-like illnesses, screening for tuberculosis in acute severe respiratory infections. In addition, during the lockdown, states conducted program reviews through video conferencing platforms. Drug distribution to districts was ensured by all available means of transport, including leveraging resources for COVID-19 response.
I think we are aware the TB is a long history, and I think globally, or even we are here in Indonesia, or as regionally, we are trying to fight together to tackle these TB diseases. We know that the TB can affect to anyone. Either you are young, or you are old, or you are rich, or you are poor, or even you are small children or elderly. So we know that the TB can be cured as long as the treatment is done completely. And TB can be prevented by implement the health living habits, including of balanced nutrition consumption. And then I think the main thing is we know that the TB disease is not only about the disease, but the good environment, such as like, the air circulation is one thing that contribute on the TB, the disease. So we have like BCG vaccination for the children under 5 years is one of that we can go prevent the severe TB among the children. And of course, a good airflow in our house with the good circulation, and of course, like good habits. We don't smoke, and then we have like a regular exercise, and we implement especially cough sneezing etiquette that we currently during the pandemic COVID-19. This etiquette should be encouraged too. And of course, we want to make Indonesia and the rest of the world free from tuberculosis. And it should be start from ourselves, which means that every individual, every group, every cross sector can actively contribute on the prevention and controlling the TB disease.
I think what is critical here is the social behavior change. Most of us will probably be afraid to seek care because stigma is there. We are afraid of the consequence or the treatment. We might be discriminated by the general public when we have COVID, and also when we have TB. But I think this is the best time when we educate the public that early and healthy health-seeking behaviors are actually key to the early detection and therefore early initiation of treatment. In TB, we have the deaths because of the delay in seeking care. Because of delay, we transmit the disease further. But if we allow early treatment, early diagnosis, and of course prevention treatment, then we cut the vicious cycle of transmission, and we actually reduce the possibility of deterioration and the complications due to TB. So I think the pandemic gave us lessons in terms of healthy-seeking behavior, but at the same time maintaining the mental health across the different societies. Because right now, sometimes when we do not have a very good social network for support, when we listen to misinformation, then it actually it would lead to more stigma and fear for the patients. So I think sharing accurate information and not sharing the false and the myths and the misconceptions will actually help not only during the pandemic but also in TB elimination efforts.
On this World Tuberculosis Day, we must come together to pledge our continued support and services to affected individuals and their families so that the impacts on their health, social and economic aspects of their lives are curtailed. Tuberculosis is preventable. Tuberculosis is curable. The clock is ticking and we must come together to act now.